The National Cabinet will today consider lifting the ban on elective surgery and IVF procedures. There's also been encouraging signs in some states that physical distancing measures are working, with the numbers of confirmed cases stabilising or even falling.
So should Australia be following New Zealand, which is easing some restrictions from next week? Well, joining us live in Sydney, Dr. Norman Swan. Good morning, Dr. Swan. Tell us, what are your thoughts about New Zealand's lifting of the restrictions, and how quickly does it mean we could go here?
Well, it's all relative. New Zealand's restrictions were much more fierce than ours. So their restrictions, I think, even at their current, downward level, are still, I think, a bit stronger than ours. So they've not lifted the lid too much. We're still a bit better off than they are in terms of our restrictions.
We are rolling out more tests across all the states and territories. In your view, are we doing enough of them?
Well, the proof in the pudding is in the eating. South Australia per capita is by far the leader here, and they're really bottoming out in terms of numbers of cases. New South Wales is next, not in terms of rate, but in terms of absolute numbers. But New South Wales needs to be that high because New South Wales still has the highest number of cases and the highest number of new cases. Victoria's dropped down a bit, but you've got to watch out for daily numbers. They bounce around a lot, but Victoria's dropped down, and there's no cause for complacency here because testing and widespread testing, we're trying to get to everybody who's got a cough and a cold eventually, is the backstop we've got when we lift restrictions on social distancing, because social distancing is what works.
Just on this decision today about the elective surgery, I mean, we're clearly in a much better place than what we anticipated. And so do you imagine that with the elective surgery that it'll pretty much be everyone who needs it will start getting through?
Well, we may go back to waiting lists and have that as a headline. But yes, I think that I've always been slightly curious about the elective ban. I mean, I know why, because anaesthetists in particular and some subspecialties of surgery like ear, nose and throat and ophthalmology were at high risk of catching COVID-19, so I understand why, but they weren't taking up ICU beds. I mean, it's mostly day surgery or overnight surgery, and I think it's a good thing that we get back to that. And it's a good thing that people realise that the healthcare system is normalising. In fact, it always was a bit normalised, but you want people who've got bleeding in their poo to be getting a colonoscopy and getting properly checked, and people who've got a breast lump to be getting proper breast investigations and not being frightened to go into a medical centre. I think we're going to see a burst of late diagnoses of cancer later in the year. People with heart failure and so on having deteriorated. We've got to get back to a normalised healthcare system very, very quickly, not just elective surgery.
Now, we do have, compared to other countries, a pretty good set of numbers, although you make the important point that we can never get complacent and there'll still be local outbreaks. Norman, do you believe now that the Prime Minister, the Premiers and the Chief Ministers are moving to a stage where they'll have to balance their health priorities versus, I guess, growing frustrations amongst Australians, seeing those numbers, seeing those falling infection rates and asking their leaders, when is this going to start ending?
Well, the three of us have talked about this a lot over the last few weeks. It is unsustainable. People are going to get frustrated. They're going to get driven nuts by the kids at home, and something's got to be done. Now, we're in a very fortunate position in Australia where we're looking as if we are getting close to elimination of spread, if not that, very, very, very close indeed. And if you look at the numbers, the dominant number is still from overseas people arriving back in Australia of the spread. Disturbingly, there's about 10% where we don't know the contact of people getting infected, but albeit at very low numbers. But we really could get down to almost zero very quickly. And that's when, if we could just hold our water for another couple of weeks, we could be really in a very good place to lift things much faster and in a more sustained way. Because if you do it too soon and you get a second wave, this is what business fears. If we lift it whilst there's pressure on one side to lift it, there's plenty of businesses that don't want to be lifted too soon, because the worst thing they could imagine is that in 2 or 3 months' time they're told they've got to shut down again. And that's going to be very hard for government to do. A second wave could be much worse, because you're probably going to find it very hard to convince people to go back into lockdown. So I think just another couple of weeks, keeping testing up, making sure that testing regime's in place with contact tracing and isolation and quarantine. That's got to be really strict. That's the price we pay for getting the economy going again. And if we're down to almost zero, I think we can move slowly and steadily, but probably faster than you might imagine.
Hey, Norman, I've got to ask you, are you going to download the tracing app?
I will, but I think that there's a problem in the community with trust. We've seen journalists, not invaded is the wrong word, but the federal police seeking data from journalists. We've seen the Centrelink debacle. We've seen criticism of My Health Record, a bit unfairly in my view. So I think there's a trust issue. I suspect that to get large, and Australians have never liked the idea of government having data on them, the Australia card. I think that they need to legislate, and I think they need to legislate for what the minister is saying. This is how the data are going to be used. These are the people who access. These are the penalties for breaching. And I think if they do that, Australians will come to it, because I think it's a really good thing that we have additional technology to help the contact tracing on the ground.
Dr. Norman Swan, it's always great to have you on. Thank you.
It's a pleasure.